Hello, everyone, and welcome to our module on ADHD and autism. ADHD is attention deficit hyperactivity disorder. This is a disorder that affects children, usually before the age of 12, and the exact cause is unknown. Children with ADHD have limited attention, so they often struggle to pay attention and stay focused in school. They have hyperactivity, meaning they want to move all the time, and they also display poor impulse control. Importantly, however, they do not have learning disabilities. They have normal intelligence on testing, although they may have trouble in school because they struggle to pay attention and they're hyperactive. And you may be aware that ADHD is somewhat controversial. Many people think we overdiagnose it. And the reason for that is if you've ever spent time with children less than 12 years of age, you may be aware that most of them display these features here. Most children struggle to pay attention in school and they want to run around all the time and be out at recess, and that can be considered hyperactive. So some people think that we are diagnosing kids with ADHD who are actually just normal kids. There are diagnostic criteria for ADHD. These are meant to help doctors separate out normal childhood behavior from abnormal behavior of ADHD. These criteria are shown in this slide. So these children have to display frequent episodes of hyperactivity and impulsivity. It has to be present in more than one setting, so it can't just be something that happens at home but not at school. That could be a problem with the parents, or if it only happens at school, it could be a problem with the teacher. You have to see it in more than one setting. It has to persist for at least 6 months, and it has to occur before the age of 12. In addition, it must impair social and school functioning, and it has to be deemed excessive for the developmental level of the child. And this feature here is what is somewhat controversial because not everyone agrees on what is normal behavior for a child and what is hyperactivity. ADHD is 4 times more common in males. In a board question, it's usually going to be a male child. And most cases are diagnosed among children 6 to 12 years of age. In other words, elementary school children. And this is the age when a lot of children need to pay attention in school, and their parents start to bring them to doctors saying, my son or daughter is struggling to focus and pay attention. And among children diagnosed with ADHD, up to 2/3 of them will have symptoms persist to adulthood. And there are many adults who are still taking their medication for ADHD when they were diagnosed as a child. Treatments for ADHD are shown on this slide. First of all, behavioral interventions are often used. These are things like rewards for good behavior or timeouts for bad behavior. Behavioral therapy, where the child meets with a therapist, can also be used. And then finally, there are a couple of drug therapies that are used, and this is what they're going to want you to know for your boards. And the drug therapies are stimulants, atomoxetine, and alpha-2 agonists. So we'll talk about all of those now. Stimulants are drugs that increase the levels of dopamine and norepinephrine in the central nervous system. They increase the levels in the synapses. Now, it may seem crazy to give a stimulant to a child who is hyperactive, but it turns out that these drugs improve ADHD symptoms. And the way you can think about this is children with ADHD are stimulated by activity. That's why they're so hyperactive. If you give them a drug to stimulate them, then they won't need to be so hyperactive because the drug is doing the job of what the hyperactivity used to do. And that's probably why they help children, because they stimulate them through a pharmacologic mechanism so they don't need to be so stimulated by things in their environment. There are a couple of drugs that are prescribed for ADHD that are stimulants. Methylphenidate, you may know by its other name Ritalin. Amphetamines, you may know by the name Adderall. And dimethylphenidate goes by the name Focalin. The way most of these drugs work is they block the reuptake of norepinephrine and dopamine from synapses. So if you've got a neuron in the central nervous system that can release norepinephrine or dopamine into the synaptic cleft, what will happen is these stimulants will block the reuptake so that the levels will go up. There's also evidence that amphetamines can increase the release of dopamine and norepinephrine, but by one or both of these mechanisms, all the stimulants raise the activity in the central nervous system of norepinephrine and dopamine. The stimulants have a number of adverse effects, and this can be a conflict for parents if they have a young child who is hyperactive and the pediatrician recommends treatment with a stimulant. Many parents struggle with the decision of whether or not to start the drug when the child may need it for the rest of his or her life, and there may be side effects. All of the side effects relate to the fact that the drugs are stimulants, so they can cause loss of appetite and weight loss. They can also cause insomnia. And then finally, these stimulants can cause euphoria in high dosages. In the videos on substance abuse, I talk about how amphetamines are sometimes abused, and the same is true of the stimulant drugs. They all have abuse potential, and especially when children with ADHD get into the teenage years and they may start to get in trouble, parents and doctors can worry about the abuse potential of these drugs. Atomoxetine is the second therapy for ADHD. The advantage of this drug is that it's considered a non-stimulant treatment for ADHD. It may have less insomnia and less loss of appetite compared with the stimulant drugs, The reason it's considered a non-stimulant is because it only works on norepinephrine. It is a selective norepinephrine reuptake inhibitor. It has no direct effects on dopamine systems in the central nervous system. And as I mentioned before, dopamine can cause euphoria, and that's what gives drugs the abuse potential. So the nice thing about atomoxetine is that it's a non-stimulant. It may have less of the stimulant side effects, and it also has less abuse potential. Lastly, we'll talk about the alpha-2 agonist drugs. These drugs are second-line therapies for ADHD. The first one is clonidine, which is an old, rarely used blood pressure drug. I talk about it in the cardiology video on hypertension drugs. Its major side effect is sedation, so because it's sedating, people tried it for ADHD and found out that it works. Another alpha-2 agonist, which works by the same mechanism, is guanfacine. It turns out that the major effect of these drugs is that they activate alpha-2A receptors in the prefrontal cortex. New evidence says this is the major means of their benefit in ADHD, and we'll talk more about this in a minute. So when these drugs do this, they increase the activity in the prefrontal cortex, and it's believed that this regulates attention and behavior in children with ADHD. So when alpha-2 agonists like clonidine are prescribed to treat hypertension, the way they work is shown on this slide. They activate alpha-2 receptors on the presynaptic neuron. These are negative feedback receptors, so when they're activated, the neuron releases less norepinephrine, and this decreases the amount of norepinephrine released by neurons, and that decreases the peripheral vascular resistance because norepinephrine activates vascular smooth muscle. And this is how clonidine works as an antihypertensive drug, by negative feedback on the presynaptic neuron through alpha-2 receptors. The way these drugs help children with ADHD is different. There are alpha-2 receptors on postsynaptic neurons that can be activated by norepinephrine. And it turns out that many of these are found in the prefrontal cortex. And when drugs like clonidine and guanfacine activate these receptors, that is what benefits children with ADHD. Now let's talk about autism spectrum disorder, which many people simply call autism. This is a neurodevelopmental disorder that is usually diagnosed in childhood. The exact cause is unknown. And children who have autism have a couple of problems. First of all, they have abnormal social skills, so they have difficulty communicating and interacting with other children and adults. They also engage in repetitive behavior patterns. So if you've ever met a child or an adult with autism, you will quickly notice that they make hand movements over and over again, or they repeat words over and over again. These are repetitive patterns, and this is a classic feature of autism. They also demonstrate limited interests and activities compared with other children of the same age. And this is a clinical diagnosis. There's no blood test or imaging test for autism. Children are evaluated by a specialist who makes the diagnosis based on clinical criteria. And it's called a spectrum because children are on a spectrum. Some are more severely affected and some are less severely affected. We'll go through some of the criteria for autism. First of all, these children have to have deficits in social interaction in multiple settings. And the multiple settings is important because if they only have a problem in one place, it may be an individual problem with one particular adult or child. It has to occur in multiple settings with different people. Some of the things that these children may display are a failure of back and forth conversation, reduced sharing of interests and emotions. They often make abnormal eye contact and they have abnormal body language. And in school, they'll have difficulty making friends and a lack of interest in peers. Other diagnostic criteria are restricted repetitive patterns, which I told you about earlier. So these children often have repetitive movements or use of objects, or they may say the same words over and over again. Once you've met one of these children, you can easily recognize this type of pattern. You'll see that they do the same thing over and over again. Along those same lines, they insist on sameness. In other words, they want things the same way every day. They want to do a certain thing at a certain time. And if this doesn't happen, they can become agitated. They have an unwavering adherence to routines. They're also preoccupied with certain objects. So they may have a certain item in their house or their home that is their favorite thing, and they do certain things with it every day, and they are preoccupied with that specific object. To meet the criteria, the symptoms must impair function. And then lastly, and this is very important for your boards, they're going to want you to know this, the symptoms must be present in early development. Autism is often diagnosed at about 2 years of age, but when you look back in time, there is evidence of autism starting in early development. Researchers have looked at videos of children who were diagnosed with autism back when they were a few months old or a year old, and they can see early evidence of the restricted patterns and difficulty with social functioning. So this starts in early development. A child who is completely normal until age 5 or 6 and then develops symptoms of autism does not have autism. That child has something else. In autism, the symptoms are there from early development. That's why it's called a neurodevelopmental disorder. These children can also have some element of intellectual impairment. Intellectual impairment was formerly called mental retardation. This is variable. They often have some skills which are weak, like verbal communication or reasoning, but they may have other skills that are normal. And there is a subset of children with autism who are called savants. These children have exceptional skills in one specific area, for example, memory, music, art, or math. So the classic example is a person with autism who is able to determine the day of week for any given date. They can basically do this by memory. This is a savant. And if you've ever seen the movie Rain Man with Tom Cruise and Dustin Hoffman, that is the story of a man who is autistic and is a savant when it comes to math. So I mentioned this before, but autism is often identified by a pediatrician. Sometimes the parents bring the child in out of concerns of socialization or learning, and then the pediatrician recognizes deficits that may suggest autism. The children will have issues with behavior, language, socialization. They may fail to reach developmental milestones. And once a pediatrician identifies these things, they usually refer the child to an autism spectrum disorder specialist who can make the diagnosis. Autism is more common among boys. It's 4 times more common in males than females. And this is an interesting factoid, but something you should know for your boards, that many children with autism have an increased head circumference. So when you take a baby or a child to the pediatrician, they measure the head circumference and plot it on a growth chart to see where the child lies. In 25% of cases of autism, the child's head circumference is greater than the 97th percentile, meaning it is very large. There are a couple of genetic disorders associated with autism. The first one is the Fragile X syndrome. I talk about this in videos in the genetics section. This is an X-linked disorder, so it occurs in boys, and it involves an excessive number of trinucleotide repeats in the genome. Children with the Fragile X syndrome have a long face, big ears, and testicular enlargement, and in addition, they often have autism. Double Y males are males who are born with an extra Y chromosome. They tend to be tall and have severe acne, and they also have a higher incidence of autism. And an easy way to remember this is both of these are genetic disorders associated with the sex chromosome. So if you forget the exact disorders and you have a board question, look for something involving the sex chromosomes. That's usually the type of thing associated with autism. Let's talk briefly about the treatment of autism. What they're going to want you to know for your boards is that early intervention is very important. The earlier the child is diagnosed and can get to specialists, the better the child will do in the long term. Behavioral management is often done. This is teaching the child good behaviors. Occupational therapy is also done. This is teaching the child skills for daily activity. And speech therapy is often done to help teach the child how to speak and interact normally. There's no effective medical therapy, and medications are only used in autism if there are specific symptoms like hyperactivity or depression. And that concludes our video on ADHD and autism.